Now, everybody knows, excuse me, that atopic dermatitis affects, I don't believe in the 30% figure, but I put it up there for purposes of this talk. I think, as Dr. Lio referred to earlier, it's probably closer to 10 to 15%. And although we do not understand the pathogenesis of atopic dermatitis, we do know that there is an abnormal immunoglobulin E immune response in the setting of skin barrier dysfunction. And that's quite an important point, because there is some very important work done by Dr. Yumi Nakamura and her team, and what they established was this. Staphylococcus aureus secretes a delta toxin. This poison damages or destroys the mast cells in the skin. The mast cells release, if you like, histamine, or poisonous granules, and that causes the skin to itch and burn. Consequently, I've come to the conclusion, rightly or wrongly, on an observational basis, not an evidence-based basis, that if you knock out the Staph Aureus, that whole cycle is going to be reduced and the patient is going to be very much better, and quite quickly. Because at a recent conference in Durban, Natal in South Africa, Dr. Elizabeth Holland, an esteemed dermatologist out of Denmark, she made a very interesting point. And she said that in laboratory testing, Fucidin cream, fucidic acid, which is a topical antibiotic which I believe will become available in the United States sometime next year, in contact with the Staph Aureus, kills the bacteria within 3 hours. And that is why those of you who have seen very dramatic responses to my mixture, it's accounted for by the elimination of the bacteria at a stroke by the mupirocin in this country, fucidic acid in others. And that is why I really believe so much in an antibiotic element to the treatment. This is the technical side, which I'll just read through for you very quickly. Mast cells contribute to immunoglobulin E-mediated allergic disorders, including atopic dermatitis. The mast cells release their membrane-bound cytosolic granules, and that is the damaging thing. And that is, as they say here, the important to the pathogens of AD and the host defense. And here is an absolutely frightening thought. 90% of patients with AE are colonized with Staph Aureus. The delta toxin is the devil in this particular product. And several staphylococcal exotoxins, with delta toxin, the prime one, act as super antigens in models of atopic dermatitis. And that's quite important in one or two of the points that I'm going to come to in a moment. The topical antibiotics, these are just the names of the two that are available. And I did want to touch on controversial subjects, and in regard to this controversy, everybody is perfectly entitled to their point of view. And I'm not here to proselytize, I'm not here to change anybody's mind, I'm simply here to present to you my thoughts for what they are worth in regard to red skin syndrome, brow tract atopy, topical steroid withdrawal syndrome. I've labelled this particular section out of left field, because I would like you to know that I know a little bit about baseball, and I, in fact, in Atlanta the other day, went to watch the Braves versus the Phillies, and in local vernacular, Braves clipped the Phillies 2-1. Red skin syndrome. The reason that this occurs is, and I did allude to you earlier, I do not think that this is a syndrome. I think it's a sign of failed topical corticosteroid therapy, meaning steroid number 1 is chosen, there is short-term benefit from the use of the drug. On cessation of that treatment, there is a flare-up of the condition, and then, quite understandably, the physician, the dermatologist, the allergist, or the pediatrician will prescribe a stronger steroid. That goes on and on and on until eventually the steroids have no further effect and the skin is diffusely red. And that, to my way of thinking, is simply a sign of staphylococcal infection, which is not being treated. Not a syndrome. Topical steroid withdrawal syndrome, another controversial issue which is quite interesting, because in the end, I don't believe that you can be addicted to topical corticosteroids. In the same way that if a patient is being treated for diabetes or being treated for hypertension, high blood pressure, if you stop the therapy in those conditions, or you inadequately reduce the therapy, you will get a flare-up in the same way that you get flare-ups with eczema. In other words, the sugar levels in the blood will increase, the blood pressure will go sky high once again, and I have to say that those patients are not addicted to antihypertensive or to anti-diabetic drugs. And therefore, I don't believe that our eczema patients are addicted to the steroids. I simply believe that the steroids could be used in a more appropriate and a more effective manner. However, those are my views on that. And the term that I've coined here is rail tract atopy. And rail tracts, as you know, run parallel and usually do not meet. On the dermatological side, we believe less in allergy than perhaps we might. On the allergy side, I think the allergists and the pediatricians put too much emphasis on the question of allergy and not enough on the question of infection. And that is why we run parallel and do not often have points leading one to the other. Now, having said that, what I have found, once again, this is not evidence-based, it's observational-based, that if you clear the Staph Aureus, it is quite remarkable how many of the allergies disappear. And in these children, or adults for that matter, these are not allergies. The skin is so reactive and it's so sensitive that almost anything they contact is considered to be a trigger factor, and many of them aren't. Now, this is not to say that children are not reactive to grass, for example, to eggs, to wheat, and so forth. Many of them are. And perhaps the allergists need to take on board a little bit more of staph side thing, and we dermatologists mustn't neglect or ignore the question of specific allergies. And the next trap here is if your child, or if a child has high levels of immunoglobulin E, so-called E, the allergists will immediately say, this child has multiple allergies. But they do not realize, perhaps, that EE is also increased by skin bacterial infection. And this particular slide on your screen, I draw your attention to the fact that the reference is dated 2001. That's 14 years ago. And we are still not looking adequately or aggressively enough at secondary skin infection. We're looking too much at the allergic side. Now, I'm going to end my talk before I'll be happy to answer any questions that you may have. And in the 18th century, there was an English poet.
Next slide.
Thank you, sir. There was an English poet called Oliver Goldsmith, and he wrote a pastoral poem called The Deserted Village. And he described this idyllic life in an English village. And along as the pastoral poem went along, the highly respected and dearly loved preacher died and was replaced by a new man. The congregation was highly skeptical and very suspicious of this man, and not at all happy with his presence. However, truth from his lips prevailed with double sway, and those who came to scoff remained to pray. Thank you very much for your attention this morning.